Hey guys, ECRG here. Today we're going to be talking about remote monitoring versus traditional monitoring. But is remote monitoring going to kill off traditional monitoring? Up next. Hey guys, there's a common misconception about the differences between remote monitoring and traditional monitoring and how they're going to be used in conjunction with each other or whether one is going to win out over the other over the long term. And I'm here to tell you that neither one is going to kill off the other one, or remote monitoring is not going to kill off traditional monitoring in the near future. Maybe in the super long term, but there's going to have to be a lot of things to happen to kill off traditional monitoring. But they're really to be used in conjunction with each other. So that's good news for a lot of reasons. The sites like having remote monitors on their studies because they always have someone who they can reach out to and talk to if they have a particular question, who's going to respond usually a lot faster than a traditional monitor is because they're always in a plane somewhere. They're always on site dealing with other issues somewhere. So they don't always respond in a timely manner. In fact, they sometimes rarely respond in a timely manner, especially considering at what part of a study it is or how busy or stressed they are. So they like having remote monitors oftentimes, in-house CRAs, things of that sort, so they can ask questions to them. Also, when used appropriately, CRAs should like having remote monitors too, because remote monitors can collect documents remotely from the site. So the CRA doesn't have to necessarily worry about that. The remote monitor can answer those questions like we talked about. So the CRA doesn't have a full inbox dealing with a lot of questions they have to answer. The remote monitor can really help out when used appropriately in conjunction with a field CRA. And that's really where the industry is heading. And don't get confused with remote monitoring, risk-based monitoring. That's something completely different. And don't get that confused. Risk-based monitoring is really like a strategy of monitoring. But remote monitoring and traditional monitoring is something that's going to be used in conjunction with one another. Like I said, the remote monitor can collect different documents. They can do different things. They can close out queries remotely. They can upload things to the TMF. That can all be done by a remote monitor. They will have remote calls with the site to ask them about any questions. And it doesn't cost a lot of money to have a remote call with a site for like 30 minutes or an hour. And you can keep the site more on track with collecting data, following the protocol, making sure that they're doing what they need to be doing, so that when the CRA goes on site, the CRA can more so focus on things that only can be done on site, like IP accountability or source document verification. Those are things that can only be done on site for the most part. There are some instances where there is some remote source data verification, but as far as IP accountability, there's only one way to go on site and to check that out. Two, sites, CROs, and sponsors, even though traditional monitoring is more expensive than remote monitoring, there is something to be said for always going on site and really developing a relationship with the people that are collecting the data. You want to build that relationship, especially if you're the CRO and the sponsor, because at the sponsor level, then you have a relationship with the site that you can use for future studies. And same thing at the CRO level. For future studies, it may be easier to recruit PIs into those studies if you have that personal relationship. And you really build that relationship through your CRAs. So traditional monitoring isn't going anywhere. Just the way it's done is going to be slightly altered because it's going to be done in conjunction with remote monitors, or sometimes they're called in-house CRAs. Sometimes they're called remote site managers. Sometimes they're called central monitoring associates or clinical monitoring associates. Whatever the name is, they're remote monitors and they all do roughly the same thing. So they're really to be used in conjunction with one another. And we don't see that changing for a while. A lot of CRAs have trouble with incorporating a remote monitor into their workflow because usually they're used to doing everything themselves. they're used to being in charge of everything and they're being the primary contact for the site. And when there's somebody else involved in the workflow, it can be pretty confusing for CRAs. So we're not going to fault them there. Like any time there's a significant change, it can be confusing. So CRAs sometimes don't necessarily like having remote monitors, but I think in the long term, CRAs will like having remote monitors, and it should make the job even easier for them. So just want to talk about that. If you're interested in becoming a CRA, a remote monitor, or just breaking into the clinical research field, we do have a resume review program. For people specifically that are entering in clinical research will probably need it the most, but we do have that. So if you're interested, email us at eliteclinicalgroup@gmail.com for any inquiries you may have dealing with that, or just any inquiries in general. Any questions dealing with this video, put them down in the comments. As always, like this video, share this video, and subscribe to the channel. Thanks, guys. Take care.